Well, welcome to this episode of Human Rights Commission in a Minute. And I'm Abraham Funchess, your Executive Director for Waterloo Commission on Human Rights. And today I'm with Commissioner Terrance Hollingsworth. We want to talk a little bit today about the Cedar Valley Focus on Diabetes, which is happening on September 10. And this will be taking place where, Commissioner Hollingsworth?
At the Waterloo Center for the Arts.
All right, wonderful. How long typically does this event last?
So it's from 11 to 2, again, at the Waterloo Center for the Arts. And it's going to be a great event. We have a presentation on heart disease and diabetes. We have some presentations or resource tables of, different companies that are providing services for diabetic patients.
Oh, wow.
And then we have the best part of it is screening. So come get an A1C screening, come get a foot exam, come get dental screening, get your blood pressure checked, and just essential basic healthcare services.
Oh, this is fabulous. Now, we know that diabetes is a disease that doesn't discriminate,
Right.
but obviously disproportionately black and brown people are impacted most by diabetes, am I right?
Yeah, but truthfully, I haven't run into a single person, regardless of ethnicity, that says, I know somebody personally that has diabetes, has negatively affected their lives and the family's lives. And so that's one of the reasons why the event was started, was because, people, you go into a doctor's office and, sometimes it's hard to get into the doctor's office.
Yeah.
Sometimes they don't have enough time to share the new technologies and information that's out there in terms of education. And so we wanted to centralize a place where people can come, hear about new technologies, put their hands on some of the new technologies, hear about the new treatment options, and have the time. Because, sometimes the doctor's appointment is 15 minutes, 20 minutes, and then, it's done. So,
But brother, I do know people who've had diabetes flare-ups and that kind of thing, and they end up on dialysis and that kind of thing. I think I know a lot of people that know other people who've had diabetes or are struggling with diabetes because they're complaining about foot problems and you name it.
Yeah.
I mean, so it affects people in different kinds of ways. But obviously, this is a great event, and you are working with Bridget Saffold, right? What exactly is her title?
Yeah, so Bridget is the event organizer. That was her idea to start it. She talked about at one point, people coming into the office and they were asking for samples and, needing extra help, that they just needed more time to talk to people and stuff. And so, she was, this was about 7 years ago. This is year 8. And
okay.
so
This is not your first rodeo.
Yeah, right.
Right.
So, it started from there. And, luckily for us, the community responded well.
Yeah, no problem.
The drug companies responded well.
Yeah.
And so now we've earned the endorsement of Iowa's Healthiest State Initiative. We got some other things that, the city of Waterloo has a declaration or proclamation calling Diabetes Awareness Week the week of the event.
Yeah.
And so, we're just doing some really unique things that,
Yeah.
Support the idea of supporting diabetic patients and their families to come in and learn, because diabetes doesn't just affect the person, it affects the entire family. As you said, amputations, right?
Yeah.
Truthfully, diabetes, the number one cause of amputations is what? Diabetes.
Diabetes?
Yeah.
Okay.
Number one cause of kidney failure is what? Diabetes.
Okay.
90% of diabetics have heart disease.
Yeah.
Also, 90% of diabetics also have heart disease, right? And so all these things that diabetes affects, and of course high blood pressure and stroke as well, just creates this space that says we need to make sure that we have a plan, as a community, and we have a plan as families to address the diabetic problem.
Yeah, I'm learning something all the time when I talk to Commissioner Hollingsworth about diabetes, but this is one of the great events that happens annually right here in the city of Waterloo, and it's the Cedar Valley Focus on Diabetes. Bridget Saffold, Commissioner Brian Hollingsworth, and I tell you, we continue to learn something new every year. This thing has really grown significantly too in the last 8 years. I know you started off small. If I recollect correctly, it was initially at the Freedom Center, Jubilee UMC Freedom Center, at least an episode or two. Now you've blossomed out. You're at the Waterloo Center for the Arts. This event happens this year, September 10. That's Saturday, September 10, for about 4 hours?
About 3 hours,
About
11,
3 hours?
11 to 2. I will have a presentation about heart disease and diabetes starting right at 11.
Okay.
And it's a good place to come and ask questions. We'll have a space where it's called Ask the Doctor.
Yeah.
So if you have some questions, you can come in and get answers immediately, take those things back to your doctor and say, hey, I heard about this, can you help me?
Yeah, yeah. And so tell me again, now, how does one get diabetes?
Okay, so good question. There's a lot of different types of diabetes actually, but we hear a lot about type 1, which is an autoimmune disease. Usually affects young kids and things like this. But what most people are talking about is the type 2 diabetes, which is basically a lifestyle thing, right? So how you eat matters if you're getting exercise. If you're overweight, that kind of tends to lead to developing diabetes and things like that.
Well, then this exacerbated things tremendously during the season of COVID. I mean, because we were hit so hard with COVID, and that definitely disproportionately impacted Black and brown people. A lot of people that look like me. And so I was wondering, how did that impact the numbers here locally in Waterloo in the Cedar Valley?
So there's no... What I understand from a drug rep, so this doesn't come from the state or Department of Public Health or anything like this, but a drug rep told me that the average A1C in Black Hawk County is 10. Well, you're considered diabetic at 6.5.
Okay.
And so we know that there are a lot of people that are developing diabetes, but one of the things that's true is that they're developing it at a younger age.
Ugh.
And so younger people are getting, diagnosed as a diabetic and going on insulin, and one thing that we hope to do with this event is to just share the information and say, guess what, you may be here, but this is how you kind of reverse it, right? You start to get a little bit more exercise. You start to eat a little bit better. And if you do that, then, you can successfully bring your A1C from wherever it is to a lower level. Yeah,
and one of the things we also appreciate, Dr. King said a long time ago that one of the major areas of inequality is the inequality that's present in healthcare. Am I right about that?
Absolutely.
Yeah, as a matter of fact, I think you've got it as part of your tagline, if I'm not mistaken.
Yeah.
Okay, all right. So tell us again as we begin to kind of wrap this little session up, but so what happens on September 10 when the folks come in to get a diabetic checkup?
So we'll have several areas, but a person will be able to get a A1C, a dental exam, blood pressure check. They'll be able to get a foot exam, all at no charge, thanks to the Human Rights Commission. But
we're sponsoring the event, but you got a lot of medical vendors and that kind of thing.
So and that's the other part that's true, that the same people that you are using their products, you get to come and get to talk to them and ask them things about how to use it better or how to use it well. Maybe it's a cost problem, and they can, all these organizations have ways that people can get their product at no cost. And, those are one of the things that we talk about, that maybe the doctor is not sharing that with you, but if you come into our space, then we can help you.
That's wonderful. And you got a lot of politicians that roll through there too now, don't you?
Yeah, that's been a good thing. I mean, if you really think about it, healthcare has been a defining issue of this generation, and so therefore, it's great to see politicians come in and learn firsthand of, how their impact with legislation. The new legislation, the Inflation Reduction Act, actually will cap the cost of insulin to $35 a month for Medicare patients.
I thought that was scratched out. Was that not scratched out by some of these?
No, I thought it made
politicians?
it into
Okay, well, that'd be
final
fabulous.
bill.
That'd be fabulous. That'd be fabulous.
Yeah, it would be. Only for Medicare patients, but still, they're on fixed income. And 1 in 3 Medicare patients are diabetic. So
Wonderful. Well, hey, this is Waterloo Commission on Human Rights in a minute plus. And and we're hoping that we brought some good information to you. Again, this is Commissioner Hollingsworth advocating for Cedar Valley Focus on Diabetes. And the next event is this year, 2022, September 10 at the Waterloo Center for the Arts. It's going to last from 11 to about 2 o'clock. And not only can you check out diabetes, but you can also get some good information on heart disease, and they'll check you out there too, right?
Yes.
You're working with who? Allen College?
There's so many vendors here, to be totally honest. But
Unity Point.
Yeah, you'll recognize the vendors, to tell the truth. They're all, the one thing about it is everybody there is, they work in the profession. Yeah. So we have some doctors there. We have, nurses that every day they're working in healthcare. And the big organizations, they're there, and that's a positive.
That's fabulous, fabulous. So this is another great event coming to the community. Waterloo Commission on Human Rights is sponsoring this event along with some other great vendors all across the city. And so we hope that you are there, and I hope to see you there. So you all have a wonderful day, and keep hope alive.
Cedar Valley. Join us for the Cedar Valley Focus on Diabetes. Reclaim your health. Get a free A1C or blood pressure screening, a foot or eye exam. How about a dental fluoride treatment? The Cedar Valley Focus on Diabetes is the premier healthcare event in the Cedar Valley. Saturday, September 10th, 11 to 2 at the Waterloo Centers for the Arts.
Did you know? The flu increases the risk of heart attack by 3 to 5 times and stroke by 2 to 3 times in the first 2 weeks of infection for our elderly parents and grandparents. Get your flu shot at the Cedar Valley Focus on Diabetes.